Thank you, Mr. Chair. I was a little surprised myself, but that being said, it is an important issue, and I will be voting yes on this bill. But I do have a couple of questions to the chairs. In our testimony, in our conversations, there were issues related to estimated revenue that could be lost. They range from possibly 10 million to 50 million. Is there any additional clarification that the chairs or anybody could help us in regards to a fiscal loss note of revenue?
Thank you for that question, Senator. Yes, I'm sure it's weighed on many of our minds. We know that there is obviously some revenue impact. I believe the numbers you quote are reflective of the fact that it is not certain. There's some measure of speculation trying to project forward what activities will occur. I'm not going to put the chair of the Finance Committee on the spot on this one, Representative Scanlon, other than to suggest it's more than zero. It is probably less than 100 million. I'd be pretty confident about that, but we are not sure about the precise number. So any revenue amount is of consequence, but I would argue that this is, if more than nominal, not a huge amount of money. And given the healthcare benefits, which we have also not measured, the cost to our community, to our insurance companies, and most importantly to the individuals affected, has not been captured, and I would argue could easily exceed the revenue impact.
Thank you, Mr. Chair. And I asked the question because it is important to note, but I also believe that when we discuss these kind of issues, that revenue should not be the driving factor, and that we should look at a more broad and holistic approach. But I do want to make a note that it is going to be a revenue lost. The second point I wanted to point out is in the issue of well-documented of addiction. But it was brought up in the testimony in regards that a black market could rise and to feed the addiction, despite all our best efforts to prevent it. And also the second point would be surrounding states have not made this ban. So what do you say to those arguments that, it seems like, nobody else is doing this and there's a black market right across the border or a legal market? What do you say to that from a standpoint of how we're approaching it when there aren't other issues, other states paralleling us to affect this policy?
Thank you, Senator. That's a really good question, and one which is not simply pertinent to this bill, but to so many bills we consider as a legislature. For example, we're aware of the fact that the federal government is engaged in activities related to flavored products, which may even supersede the activities we take on here. We don't know what will transpire. They're in the middle of their process. As we've seen on this and so many bills, states are oftentimes not even moving in the same direction. In some cases are moving one way, in some cases are moving other way. I mean, this is not our committee's cognizance, but if you want to talk about voting restrictions, there are some states like Connecticut that are trying to enable everybody who's eligible to vote, and there are other states that are going in the opposite direction. So I would argue that we should always be aware and interested in what other states are doing, but that we have an obligation to the citizens of the state of Connecticut to do what's best for the people of the state of Connecticut.
Very well said, Mr. Chair. And perhaps maybe or maybe you kind of can surmise where I'm going with this is that I hope to have true bipartisan support in this bill. And based upon the overwhelming support from health advocate organizations and from medical and substance treatment organizations in support of this bill, understanding the perils and the dangers of tobacco smoke, I genuinely hope that they will have the same level of enthusiasm and offer their professional input in discussions relating to marijuana legalization. It seems to be deathly silent on that area of discussion from a standpoint of addiction, from a standpoint of public health. I worry the fact that as we explore other venues, that we kind of fall into an easy trap that you articulated so effectively, saying that perhaps maybe we should be doing things differently than other states for the best interest of our citizens, and that we should not be basing our policy decisions based purely on revenue. So again, I hope that, again, we have some consistency, and I hope that the same people that are so vehemently, so strongly in support of this bill, that they have the same kind of vocal input to maintain that consistency in regards to marijuana legalization, because perhaps if we do legalize it, and it seems like there's momentum, that we may be back in the same position about marijuana 5-10 years from now. So I'll be voting yes on this, because I believe that we do have an important role in this, and it is not because of revenue, and it is not because of what other people aren't doing. It is because it is the right thing for the greater public health of our community. So I thank you, Mr. Chair, for this opportunity, and I hope others will rise up and offer their viewpoints in regards to this and stay consistent throughout in future discussions.
Thank you, Senator. I think we all strive for consistency, even if we often fail.